All right, I think we are live here. If you guys can see me, go ahead and give me a thumbs up in the comment section so I know that this live stream is actually streaming. So let's see if we're good here. Just waiting to see some comments from you guys. If you guys can see me, just give me a thumbs up. Let me know how the quality is. I think we're good to go, but let me know in the comment section. Are we looking good? Awesome. I think we're good. There's the thumbs up, the thumbs up. Everyone's giving the thumbs up. Awesome. Well, good morning, everyone. Well, depending on where you are in the world, hello, good night, good evening. I don't know where you guys are all from. Let me know in the comments, though, so I can kind of see and say hi to a few people. Hi, Haley. Faith, what's up? I see Faith's name on here a lot. That's awesome. Alex, how are you? Candy Cane, we're just waiting for a few more people to hop in here. I got another. Whoa, look at all these thumbs up. Emma, thank you. I even got a heart in there. Omar, hi. Good morning. All right, guys. So I'm actually really happy that this is working this time because if you guys remember, the last live stream was like an absolute disaster. It was my first time. And like 20 minutes before we actually went live, I was on FaceTime with my girlfriend and the microphone stopped working. And I was like, oh my God. Now I bought this microphone for the live, and now I can't do the live. And then I started using the computers, and the stream was dead. It was a disaster. It was absolutely terrible. But we're good. We're good. We have people filling in here. Wow, look at you guys. Indiana, Los Angeles. Wow, I'm from Los Angeles too. Cool, Nepal. How do I donate? There's actually a stickers button if you guys want to donate. I activated the super stickers. I don't really know how that works, but if you guys want to do that, that's awesome. Awesome, awesome, awesome. There's a delay between voice and mouth. Well, hopefully that gets ironed out as we move forward here. If it's really bad, let me know. I will try and fix it. Bahamas, Mississippi. Look at you guys from all over the world. Italy. Cool stuff. Awesome. Well, I think we've kind of given enough time for everyone to kind of check in here. So I'm going to go ahead and kind of give you a little bit of an outline of what I want to go over. There's just like 3 things I kind of want to talk about in today's live. And then I'm going to open it up to questions. So go ahead and send those in. I'm going to you're going to see me like look over here to kind of check and see if there's any questions that I can kind of jump to, or I'll write them down. But we'll go through these things first. First, I want to kind of talk about whitening mouthwashes, because I mentioned it in the last video about teeth whitening with braces. And then a lot of people are like, wait, what mouthwash should I use? So we'll talk about that first. Then we're going to move on to white stains after braces, and then a little bit about gum recession and black triangles. And then I'm going to open it up to some questions here. Okay, so the first thing I was going to talk about was the whitening mouthwashes. And whitening with braces, we talked about this before. We don't want to do too much whitening, aggressive whitening when we're in braces, because it's basically like there's a bracket on the tooth and we can't whiten the area under it. So if you take the braces off and everything else looks super white, the area under the bracket may not be fully whitened. Now, some of it might be because you can go under the bracket through the tooth structure, but a lot of that area can't be whitened. But you can use things like whitening mouthwashes and whitening toothpastes, right? Which, if you guys remember in the last video, I totally butchered that. But anyways, so the whitening toothpaste, what I mentioned was you want to use something that has some whitening agents in it. But the mouthwashes, I totally forgot to mention. Congratulations to Poison for getting your braces off. And the my gosh, this is so hard to say. The whitening mouthwashes, what you want to look for in those agents is you want to look for something that has some peroxide in it. Because peroxide is what's used to kind of break up those organic stains in your tooth structure. But what I'm saying is use a mouthwash that has this concentration kind of balanced out. You don't want to go and buy hydrogen peroxide. Don't do that and put it in your mouthwash, because that's really, really aggressive. It can actually cause tissue sloughing and a lot of problems, right? So you want to use the mouthwash by either Crest has actually a really good one. I'm not sponsored by Crest. A lot of people have asked that. But Crest does have a really great mouthwash to whiten that. And I could put that in the description of this video after, I think. I'm no pro by any means of these lives, but I can try and link that out in the description of this after we're all done. But with those mouthwashes, you want to use them maybe once or twice a day. You don't want to use them too often, because a lot of people might gain an irritation from these mouthwashes, so use it a little bit. A great way to use it is actually putting it in your WaterPik solution. So if you don't have a WaterPik, please invest in one of those. But you can put the mouthwash in the WaterPik solution, and it'll work really well, maybe once or twice a day. And by the way, I don't know if you guys have noticed, but do you guys notice this new beautiful camera setup? We just got it a couple of days ago, and this is my first time going live with it. I actually filmed this week's episode, this one coming this Saturday, last night, and it looks freaking awesome. So if you guys are loving it, let me know in the description in the comments of the video. Okay? Good stuff. Okay, second thing I want to hop into is white stains. All right, so white stains aren't caused by whitening products. A lot of people think like, oh, I have these white stains on my teeth. Is it because I used whitening toothpaste? No, it actually is the opposite. These white stains that are on teeth after braces are called white spot lesions because they're white spots and they're lesions on the teeth. And these are actually caused by early cavity formation. So this is not a good thing. This is something that is basically a cavity was about to begin, and this is because of poor oral hygiene. So if you had plaque and bacteria all over those braces, it builds up and you can have cavities form around the braces, so that if you have this demineralization and you take the braces off, you actually have early cavity formation. So this is no bueno, okay? This is not what we want, and there are some tricks that your dentist and orthodontist can do to reverse this. And the way they do it is they basically either can remineralize your tooth or basically open up your tooth structure and fill it with a resin. This is called Icon. It's a product that can be used to do that. So if you have these white spots, you can discuss it with your orthodontist or your general dentist. But those white spot lesions aren't caused by whitening. They're caused by early cavity formation, okay? Let me see really quick here. I kind of want to look at the questions here and see if I can, anything that like sticks out. Man, you guys are awesome. Thanks for all this engagement, by the way. Shout out to hitting 70,000 subscribers. What? This is amazing. I never thought that we would be this huge. So thank you. All of you guys are every single one of you guys have contributed to this, and I just want to say thank you from the bottom of my heart. Let's get to 100,000, huh? I'm very excited for that. Okay, let's answer a few questions, and then we're going to hop into gum recession and black triangles, okay? Is it normal to not have wisdom teeth? That's asked by, I don't even know how to say that, K-Twain Eco. You know what? Yes, it's actually increasingly more and more more and more common that wisdom teeth are not developing. And this is because evolutionarily, we're moving away from needing wisdom teeth. Wisdom teeth were used back in the day when our lower jaws and upper jaws were more forward and there was more room for teeth in the back. But as we've evolved and our diets changed more from eating, having to chew a lot, it's moved back, which made us so the wisdom teeth were less and less useful. And by being less and less useful, the jaws moved back and we actually don't have room for wisdom teeth. And a lot of people aren't even developing wisdom teeth these days. So it's not happening, overnight, but it's happening over an extended period of time. Okay, let's see here. You look great. Thank you. Do braces hurt? Braces don't hurt. I have a whole video where I talk about this. Braces feel like your teeth are bruised, but they shouldn't be hurting. There shouldn't be a lot of pain with them. More or less what you should have is a little bit like a little bit of discomfort for a couple of days and it goes away. But getting your braces on or taken off shouldn't be a painful procedure. Everything in the office should be relatively painless. I can't think of an incident where something is painful other than maybe a little bit during a tightening, but it's not too bad, okay? How do I clean my retainers? Great question. Where is that? Maria, or Maya? That's a really good question. The way you want to clean these retainers is by using a toothbrush with no toothpaste, okay? Toothpaste is an abrasive agent, and it cleans away, the toothbrush is used really well to kind of clean up the toothbrush, the retainer, but you don't want to be using a toothpaste because toothpaste is like sandpaper on it. It can increase the porosity, and that makes it so more gunk and stain can be picked up by the retainer. So use it, brush it either using mouthwash or using hand soap. Hand soap's really good at kind of cleaning up all that plaque that could build up on it, but do not use toothpaste. If you develop these white spots on the retainer, what you might see sometimes, that's calcium deposition. That's normal, that's from your saliva. What you can use is a little bit of a denture cleaner and dissolve it in there for about 15 minutes and you can clean it right up. There's a whole video about cleaning your retainers, so check that out. Okay, lots of questions here. This is amazing. Great questions, everyone. I'm gonna hop into those, but I do want to touch on one that was asked literally on every platform. It was asked on my Instagram, which if you don't follow yet, do it now, Dr. Greg Ortho. If you guys start following me right now, I will give you a few people a shout out here. So follow me on Instagram at Dr. Greg Ortho. I'll keep my eyes peeled for that right now. Okay? But yeah, it was asked on Instagram, it was asked on the Braces Club, it was asked on YouTube, so I need to answer it. It's about gum recession and black triangles. Now, we talk about black triangles in a previous video, and we say that black triangles are caused by a recession. But I never really addressed what recession is. So there was this like saying in dental school where they say, the tissue is the issue, but the bone sets the tone. So recession occurs when the tissue goes down, but the only reason that tissue would go down is if you have bone loss, because the tissue rests on the bone, and if the bone goes down, the tissue goes down, and you start seeing recession. Recession can be caused by a bunch of different things, okay? One, it could be caused by aggressive brushing. So if you're brushing too hard or using too aggressive of a toothbrush, you can actually irritate the gums, which will cause the gums to go down. All right, that's one reason why you can have recession. Another reason is by not brushing enough or flossing enough, because like we talked about in that black triangles video, when you have plaque buildup between the teeth or on the teeth, what happens is your body views that as an infection. So it wants to run away from the infection. First, it'll try to flush blood in the area, which is why you might bleed when you brush and floss. But if that doesn't work, the body's like retreats away. So it'll go down, the bone levels will go down, and this is a permanent process. It doesn't actually reverse. So you want to maintain really good hygiene, because if you start getting that bone loss go down, then your gums will go down, and then you're going to have that recession, black triangles, and all that bad stuff. Another thing that can actually occur and cause recession is orthodontic plans that aren't ideal, okay? So let's say you have a case that should be treated with extractions, and whether that's necessary or not, that's not my place to talked about that with your orthodontist. But let's say you needed extractions but you didn't, and your teeth got pushed forward kind of out of the bone. Well, if your teeth are kind of being pushed out of the bone, then the gum levels are going to go down to where the bone level is, right? So you could get recession if you are a case that should be treated with extractions but you didn't have extractions done. Now, is this always the case? No. Not always the case, but if the factors are right, you could lead to recession in a case like that. Okay, and Malika, that was totally butchered it. Malika totally hit the nail on the head. Can periodontal disease cause gum recession? Absolutely. It is the number one culprit of recession. So if you have gum disease and periodontal disease, that's the biggest culprit for causing gum loss, bone loss, and recession, okay? Okay, let's answer some questions for a little bit here. Why did my orthodontist put ligature ties on my braces? Great question. Great question. So there's a whole video where I talk about this, but ligature ties are used to hold teeth together. Now, with orthodontics, everything that we do, it's kind of like a tug of war. If we want to move one tooth, but we don't want to move other teeth, what we can do is tie those teeth together so that it's an unfair advantage in a way. Like let's say these 3 teeth shouldn't move, but we want this one tooth to move. Well, we can use a ligature tie to hold these 3 teeth together and move this one tooth back. On the flip side, let's say you have one tooth here, but you only want to move one tooth forward. You can modify what's called anchorage to move teeth around. So great question about that. Gosh, there are so many questions. This is really hard to do. I don't know if you guys have ever done a YouTube live, and it's tough because I want to answer a question and the next thing it's gone. It like zips up in the comments, which is great. I absolutely love you guys' comments, but it just like zips up. I am going to be having a membership thing soon. I don't really know if that's a good idea, but if I set it up, I'm going to make it so that on live streams, our members of the channel can get their questions pinned so that I can see it a little bit better, because this is wild. This is just flying up. But thank you so much for all the questions. Okay. Does fixing an overjet help position your jaw forward? By the way, love from UK and Romania. Hello. Sometimes. Okay. If we're able to if we're in the growing stages, we can actually have the mandible move forward. But if you're an adult, no. Correcting an overjet shouldn't move your lower jaw forward because you're not growing. But it can bring your upper teeth back, lower teeth forward to kind of mask that. Okay, great question. All right, how long does it take to close extraction gaps with braces? I read that before I said it here. That's a very hard question to answer because it depends on so many factors. It depends on your age. As you get older, it's harder to close extraction gaps because your bone becomes more dense, right? It depends on the mechanics of your case. It depends on, one of the big things is why are we extracting teeth? If it's because of crowding, then the gap should close pretty quick because your body's like, oh, finally space, and it'll fill in the teeth in those extraction sites. But if it's for something like a protrusion, right, it'll take a little bit longer because we have to bring all those teeth back. So it depends on so many factors. It's hard for me to answer that one. But let's go ahead and see what's up here. Look at all those follows. Man, you guys are awesome. Here, I have Nebu's following me. I have Nicole, Chocolate Wine Curls, Amelia. You guys are awesome. Thank you so much for all of you guys that are following me on Instagram. I'm going to keep vlogging about, my days. If you guys are enjoying that, be sure to give it a thumbs up and let me know in the comments of today's video. But let's see over here. Okay. Why are my teeth translucent at the bottom by Cool Ninja? Awesome question. So if you know, the tooth is made of 3 structures, right? The outermost layer of a tooth is the enamel. Inside of that is the dentin, and inside of that is the pulp. Now, the dentin is the most dense color of the tooth. The enamel is actually pretty translucent. So if you were to go and shine a light at your teeth, you'll notice that there's about a millimeter of every tooth around it that's enamel, because that's the outermost layer. And that's actually translucent. The enamel is an opaque material. Not fully opaque, or else your teeth would be see-through, but it's more translucent than the dentin. So if you're seeing that translucent area, that's actually your enamel. So that's completely normal. Don't worry about it. That's completely typical. Okay. Okay. Nibu from Instagram that followed me. Okay, how long does it take to put braces on? It depends. It really depends which teeth, how many teeth we're putting on, if we're putting the top or the bottom. My office, we usually say it's about 30 minutes for each arch. So if you're gonna do the full bonding, maybe about 45 minutes because we're already isolated. But it really depends on where you are. Also, if we were doing something like indirect bonding, where we put the braces on a tray and then put the tray in your mouth, that's much quicker. But it has a little bit different accuracy. We'll talk about that in another video. If you guys want to know about indirect bonding, let me know in the comments of the live, and I can try and get that done. And yeah, let's see what else we have here. I have a couple more minutes because I had a meeting this morning and I have work in a little bit, so I'm trying to squeeze this in here. I actually have to edit this week's video tonight and film next week's video because I'm actually off for a week next week. I'm really super excited, so I want to try and get everything done on the front end with that. Let's see here. Why does Invisalign have a shorter amount of time to fix your teeth than braces? I have braces. Okay, it doesn't always. Invisalign and braces are great for their specific cases, and there's a lot of overlap. You can use Invisalign for cases that are better with braces, and you can use braces that are better for Invisalign. But it really depends on the case. If it's something that's 1 or 2 teeth, it's a little bit more quicker with Invisalign because we can use all the teeth to direct force to 1 or 2 teeth, right? And by the way, Invisalign is just a product. It's clear aligner therapy. There's a bunch of companies that make the product of these clear trays, but it really comes down to your orthodontist on how we plan the movement. But anyways, that's a topic for another time. But braces are quicker sometimes if we have a lot of rotations. With Invisalign, we can only move teeth about a degree a tray. We can't go more than that. So let's say you have to rotate a tooth 45 degrees, right? And you're changing these trays every week. That's a year to rotate 1 tooth. Whereas a 45-degree rotation would be much quicker with braces. So it really depends on what your case is. If you're a case where you have a lot of rotations, braces might be faster. But if it's a single tooth that needs to be pushed forward, well, then Invisalign might be faster. So it really is case dependent. If you guys want, I can make a video on braces versus Invisalign. I feel like that'd be a really cool video, actually. So let me know in the comments today. If you want to see that, go ahead and give me a thumbs up, and I will go ahead and make that video for you guys coming up here, okay? So I'll do about two more questions, all right, guys? So let's get them through here. Experiment. Let's answer this one. This one's kind of fun. How many years does it take to become an orthodontist? This depends on where in the world you're getting trained. I know it's a little weird, but in the United States, you have to go to college for 4 years before going to dental school, which is another 4 years, and then residency, which is anywhere from 2 to 3 years. Mine was 3 years. So after high school, for me, I went to school for 11 years. But in other countries, they have their undergrad and dental school together, okay? And that makes it so it's 6 years. I don't know about their orthodontic training. That's something I'm not too sure of. But to become a dentist, it's quicker in other countries. But that really depends on where you are in the world. But that's a really good question. I talk about it on how to become an orthodontist, and I should do a follow-up to that because I feel like there's a lot of questions in that video, and it kind of gets flooded out by the whole braces content, which is great. I absolutely love the braces content, but I think that I should do a little bit more about the route to being an orthodontist, okay? Have you done an orthographic surgery? I have. It's actually an orthodontic surgery, and I've done a couple of these cases. I actually did an interview with, I don't know if you guys know who Shelby Church is. She's really cool. She's a big vlogger here on YouTube, and we met up. I'm not her orthodontist or her surgeon, but she has that surgery coming up actually really soon. I should text her and make sure she's doing well. And if she's watching this, hey Shelby, how are you? But yes, I'm very, very familiar with doing orthodontic surgery. I was trained in it. UCLA is very, very good at teaching their residents and their orthodontists how to do orthodontic surgery, so I am familiar with it. And I've talked about it on this channel. I talked about lower jaw surgery. I haven't talked about the upper jaw because there's a lot more you could do with the upper jaw, so I will talk about that, I promise. I know I keep promising it, but I will make that video very, very soon here, okay? All right, guys. I am actually going to have to sign out here. Thank you so much. Thank you for everyone that signed in the stream. Thank you for those that are watching this after. I really appreciate each and every one of you. And remember, we do have a video coming out every Saturday, 8 a.m. Pacific time. So whatever time this live was, that's the time that this video roughly will come out on Saturday, okay? So much love. I really appreciate it. Follow me on Instagram, Dr. Greg Ortho. Join the Braces Club. Comment on these videos. I absolutely love it. How do you treat a gummy smile? That's a video that's coming up very, very soon. But thank you, everybody. I will catch you guys on another episode. And let's do this again. I really enjoyed this live. If it worked out well, we will do another one soon. So stay tuned, probably on Wednesday mornings. By Earth's Little Secret, you are very welcome, Vishal, and much love. Have a fantastic day. I'll see you guys soon.